Hello, my name is Dr. Adi Desai. I'm an infectious disease physician at Chesapeake Regional Healthcare. Today we are going to talk about the COVID vaccines. I'm sure you all have a lot of questions regarding that. COVID vaccines are safe because they are developed on the same platform as many other vaccines in the past. There is no compromise on the safety or scientific integrity. Scientists were able to figure out the genetic sequence of the virus way early, like in January 2020, few weeks after the virus was discovered. Not only that, because of the pandemic, there were a lot of people infected with the disease. Usually it takes years to figure this out, but because of these two factors, the researchers were able to study a lot of people in short duration of time. There were no cutting corners. Vaccines are safe. Both Moderna and the Pfizer vaccine are very efficacious. They have studied them to be more than 90%, or I would say 94 to 95% efficacy. So usually vaccines work by causing the body to produce antibodies or immunity without getting the disease. So Moderna and Pfizer vaccines both are mRNA vaccine, which is messenger RNA. mRNA is a genetic material that is taken from these viruses and then introduced into the body. And body, based on these, produce some proteins and antibodies. So when somebody who is already vaccinated is exposed with the infection, body knows to produce the right amount of appropriate antibodies to fight the infection. No, vaccine does not alter your DNA. These are mRNA vaccines. It's not a live vaccine. It does not incorporate into your DNA. They are just a protein which stimulate your system to produce antibodies. There is no microchip in the vaccine. It has just a particle of the virus, which does not do anything except stimulating your immune system. And it dies out, so it does not even stay in your system for a long time. You cannot get COVID from the vaccine. This is a mRNA vaccine. It does not have anything related to the virus which can generate and produce and cause the disease itself. American College of OBGYN is encouraging their patients to get the vaccine. These categories have not been studied exclusively, but at the same time, if your risk of getting the COVID-19 is more than expected, then I would ask you to talk with your doctor, as the benefit of getting the vaccine is far more than the risk. Both Moderna and Pfizer vaccines are almost same. They are both mRNA vaccines. Both are FDA approved. The side effects and efficacy profile is almost the same. Pfizer vaccine has to be given 3 weeks apart, and Moderna vaccine is 4 weeks apart. So both are 2 doses, 2 shots, and with equal efficacy and safety profile. First dose will generate some immune response, but the second dose, which is the booster dose sort of, is going to create a stronger immune response. So yes, you have some immunity after the first, but it will not be sufficient to protect you from getting the disease. Both Moderna and Pfizer vaccines are 2 doses vaccines, so usually a week to 2 weeks after the second dose, you should expect yourself to be immune. Like any other vaccine, Moderna and Pfizer vaccines both have few side effects. You can get soreness at the site of the injection. You can expect some low-grade fever, fatigue, which means vaccine is working. In some cases, we have seen some serious side effects, including high-grade fever, headache, even the redness at the site of the injection. But the good thing is the symptoms don't last more than 1 to 2 days. As I said, the second dose of vaccine is causing more side effects than the first dose, but it does not last long. You can take some antipyretics, Tylenol, Motrin, rest, and hopefully it should be over without seeking any medical attention. So if you already had a COVID, then still you should get the vaccine, because there is a difference in the immune response when you get the disease naturally versus the vaccine, because with vaccine the immune response is stronger and longer lasting. You can avoid getting the vaccine if you have an active symptom of COVID, you are in quarantine or isolation. You can also delay it for 90 days because your body has enough antibodies to fight for during that time, and you can give it to, the vaccine can be given to somebody who needs it more than you at this time. As of now, the vaccine is still efficacious against the new strains, but only time will tell how it will go. I think like flu vaccines, we might have to see some variation and might have to tweak the vaccine a little bit, but I think at this time, the vaccine is efficacious against all the variants. The new strain of viruses that we are seeing for the COVID are more transmissible, but they are not seen to be more deadly. So at this time, vaccines are still efficacious, and I would encourage everybody to get it and do the common thing that we have been doing almost for a year, keeping our social distance, wearing the mask, washing our hands, and hopefully we will not see a lot of variation and we can get over this. You still have to wear a mask even if you get the vaccine. So vaccine prevents you from getting the disease, but you can still be infectious. And when you are infectious, you can spread it to others. So to stop this pandemic, we have to get the vaccine to prevent the infection and wear the mask to prevent infection to others. People get infected, which means they have the virus, they are exposed. Virus is in your system, but your body is keeping it in a check. So it's not making you sick. But because you have a virus, when you sneeze, cough, there are some droplets and some aerosolization, and people who are still vulnerable can get it. So yes, you won't get infected, but still you can cause infection to others. I would still say that we should avoid the grouping of the people together, even if they are vaccinated or had the disease or they are negative, because you are still infectious if you get the disease and you can spread it unknowingly. So till we are over this pandemic, I would say get vaccinated and continue to wear your mask, wash your hands, and avoid social gatherings. Hopefully everyone should be able to get their vaccine soon. Currently, the people who are taking care of patients with COVID-19 are getting the priority. Now we are vaccinating essential workers, patients more than 65 or younger patients who have some comorbidities. We all want to go back to normal, so it's tough to say when will it be normal again, but more people we vaccinate, sooner we'll be able to go back to normal. COVID vaccines are safe and effective. I got it, my family got it, my friends, my colleagues got it. We all are safe. We feel confidence in that. I think this is the only way we can get over this pandemic. So I will really encourage you guys to go and get the vaccine.